Hello everyone, I am Dr. M. Charan Kumar, founder and managing director of Elident Hospitals, Hyderabad, located at Kondapur and KPHP. Today I am here to discuss about the 5 things that damages your smile. We will see different types of patients. Out of all those experience, I am giving you the 5 things that will most commonly damaging your smile. The 5 things that are, the first one, the dental caries. Dental caries means the tooth decay. Being the second most common disease in the world, while the common cold is the first one, we have 32 teeth. All the 32 teeth have equal chance of getting the tooth decayed. The most common reasons for tooth decay are food lodgement, improper oral hygiene maintenance and different habits. So when the decay starts, it will start as a small black hole in the tooth. At that initial level, you will just have a food lodgement, and if it is going little deeper, you may have sensitivity, and if it going to more little deeper and involves the pulp, you may get severe pain, and at least you should respond in these stages so that we can save the tooth. If it is going beyond these stages and with any infection or any abscess formation, mostly we cannot save that tooth, and eventually you should end up with the removal and replacement. Again, it will be a full of mess. So better I advise to react immediately in the initial stage so that all the decayed tooth can be resolved by the just fillings. And we already did a video on dental caries and its related treatments. You can go through that. The second one is the gum disease. Say we have skin all over the body. In the same way, the tooth has the gum. So even the gum is equal to the skin of our body. We are supposed to take care of the gum. So the gum issues will come in different stages, as gum is a very sensitive part of the tooth where the food will be lodged and it creates some pressure on that one, so that gum will be swollen, and at that time you will have a swollen gums and bleeding might be there upon touching with brush or the finger or anything, and eventually if you are not going for a professional consultation at that time, it will end up in the rapid bacterial growth, and which deteriorates your bone level. When the bone level between the tooth is going down, the tooth will become apart. Some patients will be complaining, or some might have regularly examining in their mouth that teeth are becoming apart day by day. So in such cases, if there is eventual bone loss, then the tooth will directly come out. In such problems, the symptoms will be bleeding from gums, sensitivity, bad smell and initial mobility. So most commonly this type of issue will not give any severe or emergency pain, so that it will be a mostly neglected issue, and eventually when the bone loss is more, the tooth will directly fall out. At that time even we can't save that one. So for the gum treatments and everything, you can check our other videos, as we will do scaling, means cleaning all the debris or the tartar or the plaque what was accumulated around the tooth and inside the gum, or if it is more severe, we may go for the flap therapy, laser flap therapy, or with bone graft, then eventual removal. And the next third one comes the crooked teeth or irregular arrangement of the teeth. When the teeth are irregularly arranged, there is a chance of poor oral hygiene. Why? Because you might be trying to clean the tooth, but your brush may not reach all the areas and clean it properly, so it gives the space for the food lodgement. At that time also you can face the gum issues and eventually loss of the tooth and loss of the beauty of the smile. And not only this one, when there are crooked tooth, there will not be a balanced chewing forces. So when there are no balanced chewing forces, there will be bone loss or gum infections and other issues, and more food lodgement which may lead to the tooth decay on the some or the other side, and the food chewing efficiency will also be lost, so that you can't take all foods in a normal way. So better I advise to go for a professional tooth alignment with braces. The Invisalign or clear aligners are getting more trended. Earlier we used to go with the metal braces, which you are supposed to visit every month for one visit, and nowadays with these aligners it is damn comfortable, and the teeth can be aligned within a short period. And the fourth one comes the missing tooth. When there is a missing tooth, so there is a chance of foot lodgement at that area, and when there is a missing tooth like this, the other two teeth will move into the missing area, and the same way the upper tooth will come down if the lower one is missing, and lower one is go up if the upper one is missing. So when such kind of issues are there, again the same thing, the balanced chewing efficiency will be lost. Again eventually there will be gum infection and bone loss, and when you respond at that time, you will end up by treating the 3 or 4 teeth instead of getting replaced with the one tooth. And you can also check our other videos regarding what is the best options for the tooth replacement. And the next comes oral hygiene maintenance and habits. So you should brush twice daily and go for a mouth wash after each and every meal, and go for flossing at least 3 times a week. Flossing means you will have a flosser you can get in a medical shop, and you can clean in between the tooth. We call it as embrasures. In that space you can clean the tooth, and the tooth decay and other complications can be avoided. And already we did videos on oral hygiene, you can check with that. And the next comes the habits. Habits means taking more acidic foods as chocolates, candies, and especially cool drinks. And next comes the smoking. Smoking will cause a lot of damage to the gums by giving the bad breath and dry mouth. In dry mouth also the infection rate will be increased and gums will be damaged very early. In the same way alcohol, and some people with diabetes and hypertension, when they are using some medication, they will get some gum swellings. So better to consult your nearby dentist, or you can consult us for getting the treatments. So I'd be reminding again, the 5 things that are damaging your smile is: 1 is dental caries, 2 is gum disease, 3 is crooked teeth, and 4 is missing tooth, and 5 is oral hygiene maintenance and habits. So better take care of your teeth so that you can have healthy smile and healthy general health. If you want to comment or take any suggestions or take any advice, you can comment below, and we will be responding in another 24 hours. Thank you. Good day.